हाय एवरीवन, आई होप आप सबका INECET का एग्ज़ाम बहुत अच्छा गया होगा. We are going to discuss the pediatric question asked in INECET in May 2024. So here we go. Now the first question which I am going to discuss is from Anthro. Weight for age is below -3 standard deviation. Height for age is below -2 standard deviation. And weight for height is -1.5 standard deviation. अब इसमें ये पूछा हुआ था कि ये कौन सा मेल न्यूट्रिशन है, एक्यूट है या क्रॉनिक है. तो इसके लिए जो सबसे इम्पॉर्टेंट कंसेप्ट है वो ये है, इफ़ हाइट फॉर एज इज़ बिलो -2 स्टैंडर्ड डेविएशन इट इज़ क्रॉनिक मेल न्यूट्रिशन. इफ़ वेट फॉर हाइट इज़ बिलो -2 स्टैंडर्ड डेविएशन इट इज़ एक्यूट मेल न्यूट्रिशन. And if weight for height is below -2 standard deviation and height for age is below -2 standard deviation, then it is acute on chronic malnutrition. So इस क्वेश्चन में just height for age is below -2 standard deviation. So इसका आंसर होगा chronic malnutrition. Then there was a question on clinical features of some dehydration. The features are slight delay in skin pinch, restlessness, irritability, dry oral mucous membrane, absent tears, and increased thirst. There was a question on how will you assess dehydration in a child with SAM. This is a commonly asked Viva question, and the answer is by looking at the oral mucosa, by looking for tears, by looking at the pulses, by looking at the urine output, and by looking if the child is thirsty. Then there was a question on nutritional rickets. Important things about nutritional rickets are serum calcium can be normal or low, serum phosphate can be normal or low, serum PTH will be high, and lastly urinary calcium excretion will be low, and therefore urinary calcium by creatinine ratio will also be low. Now why urinary calcium excretion is low in nutritional rickets? Because the body is trying to conserve all the calcium. We are going to discuss the remaining questions tomorrow at 1 p.m. So stay tuned.